findings. He travelled to Singapore.
Malaysia has confirmed its first locally transmitted case of the novel coronavirus.
Kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan.
Okey, dia boleh kita akan indahkan untuk disingkir dan betul dia kalau masuk buat ada asid dia kita akan singkirkan.
The bio-psychosocial model introduced by Dr. George Ingle is modified and used to study the interconnection of the psychological factor on the perception of COVID-19 misbeliefs, social influences, and its psychosocial impacts towards the general public daily lifestyles. These three aspects will eventually influence the health of general public, especially on the mental well-being and the COVID-19 prevention methods or practices they choose to apply in their daily lifestyles. Through our interview, we can see that there are some modifications to people's daily lifestyle. People are keener to depend on verified sources of information to cope the misbeliefs. They will advise their older family members to only listen to medical professionals. However, some of them still attempted some of the unverified viral claims online, as our respondents admitted to have tried the hold your breath for 10 seconds test despite not believing them, due to the panic situation. In terms of online shopping, one of our respondents has decided to stop buying things online, while some continued shopping online but would sanitize the parcels with disinfectants. Clearly, the perceptions has prompted them to be more meticulous in terms of sanitization of objects. All of the respondents interviewed have perceptions that wearing a mask could actually prevent them from the novel coronavirus. The misbelief has caused them to be angry, stereotyped, being paranoid, worried and scared of getting infected when seeing asymptomatic people not wearing masks in public area. They said that they will wear a mask whenever they go out of home. In terms of hand washing, the respondents agreed on the 7 steps of hand washing, but interestingly, none of the respondents interviewed practiced the exact 7 steps. Our respondents, however, admitted they do wash their hands for at least 20 seconds, albeit not exactly the exact technique recommended by World Health Organization. It seems that they are more interested in the duration rather than the technique of hand washing. In terms of food practices, our respondents also resorted to drinking warm water by adding lemon juice in it. One also said that her mother has added garlic to almost every meal now, despite not believing that the garlic able to prevent COVID-19. Hence, it shows that the misbeliefs seem to have great psychosocial impacts towards the general public in their daily life. In summary, the modifications done by an individual on their daily life is determined by perceptions towards the disease on an individual psychological factor and social factor. It has rendered them actions and effects never experienced prior, precautionary measures and impacts on mental health. How long will these impacts last? We are keen to find out. But now, only time will tell.